Now, perhaps I'll ask you to start just by introducing yourself and your role.
Yes, I am Jan de Maeseneer. I'm a trained family physician. I am the chairman of the European Forum for Primary Care, and I'm also the head of the Department of Family Medicine and Primary Health Care at Ghent University in Belgium. I have been involved in the European Forum since the beginning, and I was very happy to attend this conference, and especially because of the fact that for the first time we had contact with Kajka, which is a very important movement of community health centers in Canada. And it was amazing to see how the experiences of Kajka and the community health centers are similar with what happened in Europe the last 30 years in different countries, in Belgium, but also in the Netherlands, in UK, in the development of community health centers. The same kind of inspiration, also the same kind of commitment towards the needs of the community and the intersectoral approach, because health is determined by so many different factors. So we have to try to find out how we can influence those factors that may contribute to improvement of health. Myself, I started as a family physician in 1978 with the building of a community health center. First with a small team in a deprived area of the city of Ghent, which is 25,000 inhabitants. And we built it up with family physicians, with nurses, with dietitians, with social workers, with the ancillary staff, and now also with dental care integrated. So it really grew in the last 30 years to one of the premises providing comprehensive primary health care in the neighborhood in the city of Ghent.
Thank you. And you shared in ending the conference and providing some reflections upon what happened at this conference, what you thought were some of the priorities for advancing primary health care, but not only primary health care, a community orientation in primary health care, including community health centers. What would you say are perhaps one or two of the key priorities in different countries and some of the common challenges and opportunities for advancing community-oriented primary health care and CHCs?
Yes, I think community-oriented primary care is of utmost importance. The concept is already very old. It was developed in the 40s by Kark and others in the Polela community in South Africa. And then it was developed in different countries. And nowadays, I think it is an approach where you try to integrate your individual work with patients with the broader societal determinants of health. Let's give an example from our own practice. In the 80s, we were confronted with the very bad physical condition of the youngsters in our community. So we did a survey and we saw that they were much more time in front of television, video games and so on, computers, and that they did not take enough physical movement and physical activity. So we brought together all stakeholders and we tried to make a community diagnosis. What is happening to the youngsters? And it was obvious, because we live with 8,000 people on 1 square kilometer. Well, there is no green space, there are no green spaces, so the youngsters did not have a place to develop and to take a physical activity. So what we do as a healthcare center, we did not prescribe vitamins or physiotherapy, we did prescribe the construction of playgrounds in the community. And together with the local community, we constructed playgrounds, and then the city took over this initiative. And it was amazing to see what the outcome of this action was. First of all, it was reported that after the holidays, the children that played at the green spaces, at the new playgrounds, they were less involved in little street criminality, as was reported by the police. This was an unexpected but very positive outcome of this action. We saw also that the physical condition improved, and the other thing was that social cohesion improved, because we saw that the mothers of the immigrant community and the mothers of the Belgian community, they met and they worked together when they were bringing and holding back their children. So you see that a simple finding in your consultation room, when you make a community diagnosis, can lead to really involving the community in the diagnosis, in the planning of the intervention and in the monitoring of the intervention. And I think that's the power of community-oriented primary care. That's also why we bring together in our community all stakeholders. Since 1986, 40 to 50 people meet every 3 months to discuss what are the problems in these communities, what are the opportunities. The local schools are there, the local hospital is there, the local kindergarten is there, the child welfare clinic is there, the community health center is there, all the local providers, the home care is there. And we exchange our experience. The local police attends the meetings just to see what happens, what are the problems, and how can we make a community diagnosis and work together to improve the situation. And I think this approach to the broader community really creates the environment where we can work for the improvement of the health condition of the population. Certainly for the migrant population in our community. Nowadays, we have people in our practice coming from more than 55 different countries all over the world. So the practice is very multicultural. And really we try to find answers to the needs in terms of health, but also in terms of social cohesion of such a diverse community where we try to work with.
Wonderful. And in perhaps 15 or 20 seconds, a difficult demand, what would your message be to policymakers around implementing and supporting a community-oriented approach to primary health care?
My message would be invest in strong primary care, creating the possibilities for community-embedded primary healthcare centers, community health centers that really can contribute to social cohesion. What you invest, you will get back because of increased social cohesion, which will lead to a stronger societal cooperation, which is good for society, which is good for economy, which is good for politicians.
Thank you very much.
It was a pleasure. Thank you.